So just to begin with, what's your interest in this conference today?
I think the direct links between climate change and non-communicable diseases hasn't been made at a global public awareness level. And I think this is a shame because there's a very clear direct links on climate change, global warming, and non-communicable diseases, which are basically diabetes, cardiovascular diseases, lung, and cancer. And with the recent UN Summit on Non-Communicable Diseases, which is just the second health summit ever conducted by the UN, the first one being in 2001 for HIV, AIDS, malaria, and tuberculosis, I think it's about time that we actually bring NCDs at a global scale, that it is a development risk, that it is a health and security risk as well for a global community.
And the kinds of health problems that you're mentioning are not traditionally associated with climate change. How are they related?
Well, with climate change, you see a pattern in basically a disruption in food and resource allocation. You see urbanization as being an issue when you have more sedentary lifestyles. You have people with less access to healthy choices. Normally, diabetes, for example, one of the NCDs, this is normally seen in lower middle income countries, but diabetes is exploding basically in more developed countries like the Middle East, India, China, because people's lifestyles changing. In China today, which is one of the top prevalence countries for diabetes, type 2 diabetes, the Chinese government actually has changed the child policy. If your child, normally they have a one-child rule, but if your first child has diabetes, you're allowed to have 2 children because they don't expect the first one to live. So that's the mortality rate of diabetes in China. And it's pretty serious if you can see China and India basically exploding with the diabetes, especially type 2 epidemic today.
And presumably a transition to a greener economy and to healthier lifestyles would address this to some extent. What are you hoping, what kind of policy measures are you hoping for that would really change this?
Well, we're looking into health strengthening systems. We don't need separate health policies for NCDs. We want to integrate ourselves into what we have today for communicable diseases like HIV, AIDS, because certain medicines you can take for HIV actually makes you susceptible for TB, which is also, for people with diabetes, you're more susceptible to TB and other communicable diseases. So you basically have to treat the whole person and not just focus on each disease aspect.
And what would be the outcomes of this conference that you would look for? What would you hope for to come out of today?
I think the morning session was very different from the afternoon session. The afternoon session, they touched more on non-communicable diseases. So it's basically, first, I think it's raising awareness that there are critical connections between climate change and non-communicable diseases, especially diabetes, with the way society is developing today, with more access to health, and access to a democracy, basically. You make the wrong choices when you build your cities. You make the environment more difficult to make healthy choices with regards to food, with the additives, with the salt you have in food. Tobacco control is now more, it's better, it's more improved than before. However, there's still an issue with tobacco control. But you see, in the UK, they basically reduce salt in a lot of foods without telling people, and people haven't noticed that. And so these type of self-regulations for industry is important, and you need basically people, private and public partnerships to ensure that this has a sustainable future today.
And is that happening? Are we seeing this kind of transition happening around the world?
I mean, in fact, the fact that the UN Summit held a high-level meeting on non-communicable diseases basically signals to the world that this is a serial global development issue. And it's a matter of having the key indicators and strict timelines to measure the changes and ensure that for the Millennium Development Goals that non-communicable diseases are a part of the issues being tackled and not just a side issue.
So just finally, you've talked about some of the costs, but could you illustrate them for us with figures? What are the risks here, and how big a deal is this?
Well, today in 2011, we're releasing our 5th edition of the Diabetes Atlas, and there's been a sharp increase in the cost globally. It basically cost $465 billion worldwide. This is diabetes type 1 and 2. And in addition to that, every 7 seconds, one person dies of diabetes. Last year was every 8 seconds. So you can imagine that this global epidemic is spiraling out of control. So we definitely need global awareness and action to ensure that this doesn't spiral out of control in the future. Thank you.